Hey, what's up, y'all? My name is Dennis Heil, and I am diagnosed with type 2 bipolar disorder with severe depression and high functioning autism. I've been living with bipolar disorder for over 30 years, 15 of which I spent undiagnosed. In 2009, I experienced a depressive psychotic break that led to my diagnosis of type 2 bipolar disorder. I would be diagnosed with autism a few years later. In my podcast, Bluntly Bipolar, I'm going to share with you my experiences and the hard lessons I've learned trying to find some peace and happiness in my life. I hope that by sharing my experiences, others can avoid learning these lessons the hard way. I'm not a mental health professional. I have no qualifications or certifications. All I am is a mental patient with a microphone. You can find Bluntly Bipolar at bluntlybipolar.com or about any podcast distribution service. Listener discretion is advised for heavy topics related to mental health, including suicide, self-harm, and more. As I say all the time, I'm not a doctor or a mental health professional of any kind. And because I feel it is incredibly important to stay in my own lane as a mental patient with a microphone, there are many things regarding medication and treatment that I will not give my opinion on because it's not my place to do that. However, as a mental patient myself, there are some things I can share with you from personal experience that may help you on your path. So let's talk about 12 of those things. 1. Psych medication is a powerful tool that needs to be treated with respect. I wish people would treat their psych medication more like you're supposed to treat a firearm. Psych medication is so common that people just don't treat it with respect that it should be. When you have a mental illness, not taking your medication as directed can be as lethal as a firearm. If you don't take it as directed, it's not going to work the way that it's supposed to. And then many people turn around and blame the medication instead of the person wielding it. In firearm circles, you'll find a similar attitude. Oh, he accidentally shot someone. Okay, so why was his finger on the trigger? Why was the barrel pointed at another person? Why was he not treating the firearm as though it were loaded, double or triple checked for a bullet in the chamber? There's a lot of things that have to go wrong to accidentally shoot someone, unless you're Dick Cheney or a P-320. A hell of a lot of accidents are the result of negligence and mishandling. That said, much like a gun, psych medication is a powerful tool, and if you mishandle it, someone can wind up dead, in jail, or inpatient. Now, if you're going to take medication, take it as directed, and make sure you keep your doctor's appointments for appropriate maintenance as best as you can. It's not something to play around with. And if you have a hard time remembering to take it on time, set timers or use like an app notification service. I know that there are a variety of apps out there that will give you reminders for things like that. Number 2, you don't know enough about bipolar disorder if you're more afraid of psych medication. I'm of the opinion that people who are more afraid of psych medication than bipolar disorder don't know enough about bipolar disorder yet. Being in the unrestrained extremes of bipolar disorder can have devastating consequences for your life, health, and well-being. Now, due to that fear of medication and the potential side effects, many people choose to live with the evil that they know. They want to try to manage their bipolar disorder naturally. And by that, I mean they look for things like supplements, lifestyle changes, or even turn to pseudoscience to control the disorder. But here's the problem. You're only giving yourself the illusion of control. You're not actually in control. You're only in control right up until you're not. And by then, it's usually too late. Psych medication does something that all of those other things don't. It provides hard limits that are enforced through the therapeutic benefits of the medication. The correct medication will stop your brain from escalating or crashing into depression. Meanwhile, natural management does not put those kinds of hard brakes on it. Meaning, if your mental illness is triggered, there's a significant chance you're going to swing into an unwell cycle. There are a whole lot of people out there who thought they had their mental illness under control with lifestyle choices, essential oils, or supplements right up until they didn't. For most of us, eventually, another trigger is going to come along and your mental illness will take off. 90% of us will experience more than one manic cycle. So you have no idea whether or not you're part of that 90%. It's far better to err on the side of caution than not, because all it takes is one uncontrolled unwell cycle to devastate your life. Suicide attempts, infidelity, impulsive actions, debt, all things that can destroy your life in a matter of seconds. In fact, once upon a time, I knew an older woman with bipolar disorder who insisted on essential oils and natural remedies. Yeah, she had a manic cycle and ended up taking out a second mortgage on her house. And she gambled, spent about $150,000 before anyone noticed and decided to ask where the money was coming from. Now, additionally, you will often hear complaints in bipolar support communities and groups that doctors just jump straight to medication. Listen, there are plenty of valid reasons to criticize Big Pharma and how medication is prescribed. However, I feel like a whole lot of people dramatically underestimate how serious of a mental illness bipolar disorder is, especially if you haven't had a truly extreme unwell cycle yet. I feel like that if I were a doctor and I had someone in my office with bipolar disorder asking about management, that it would be a safe assumption that they were having the kind of hard time that requires medication. They know how bad it can get. Doctors know that a lot of natural management practices are just wishful thinking and a false blanket of security until you hit something that triggers you into a severe enough unwell cycle. Then you get to learn the hard way just how futile that stuff can be. Not that it's not important for management and overall quality of life, but it does not offer the same kind of control over unwellness that the correct medication will. That being said, I'm not saying you should or must take medication. That's a decision you need to make for yourself with the help of your doctor. Number 3, medication side effects are not guaranteed. Many people avoid medication because they're afraid of the side effects, and rightly so, because some of them are scary. However, it's important to keep in mind that these are potential side effects, not that you will absolutely experience them. Plus, there are a lot of side effects that can go away with time. Now, personally, I had light tremors when I was on lithium, but it eventually went away after a couple months of taking it. The other factor is that I know I have much greater control over whether or not I experience these side effects versus being unmedicated. If I hit a trigger for severe unwellness, then God only knows where my brain is going to end up. Now, on the other hand, if I'm taking a psych med and I start experiencing side effects, I can go to my doctor and find a solution for it that doesn't require my going inpatient or burning through a 6-month-long unwell cycle. Now, personally, I was the same way early on. Even though I had a history of suicide attempts and extreme chaotic behavior, I was more afraid of the side effects of meds than the mental illness. It's honestly strange looking back on it. I feel like it was a situation where it was a fear of the unknown versus the familiar hell I already knew. It didn't occur to me at the time that I could easily experience more severe unwellness in the future versus this medication I'd be putting in my body that could potentially have a scary side effect. Now, your future unwell cycles may not be anything like your previous ones. Have you ever heard anyone say bipolar disorder gets worse with age? That's sort of correct. What the saying should actually be is untreated bipolar disorder gets worse with age. And it's because of brain plasticity. That is, your brain's ability to strengthen, weaken, create, and break neural connections. Every time you're unwell, your brain is strengthening the pathways associated with your unwellness. To the best of my understanding, that creates a cycle of brain damage. You swing unwell, the brain is strengthening those pathways, which makes it easier to trigger into another unwell cycle, which may be more intense and severe than the last one. The correct psych medication halts that process. You're not doomed to degenerate because of this illness. There's a good chance you will if you stay on the roller coaster and don't try to stop it. I can't tell you how many people I've crossed paths with who were riding the roller coaster, then were surprised when they got slammed with a severe unwell cycle out of nowhere. They incorrectly assumed that their future unwell cycles would be the same as their past ones. Maybe, or maybe they'll wind up with a much worse cycle. You never know what the next unwell cycle will bring. And that's one of many reasons why early intervention and treatment are so important. So the sooner you get into treatment and start taking management seriously, the better your chances for a positive long-term outcome. 4. Generic is similar but not the same as name brand medication. In mental health community spaces, I've often heard my fellow mentally ill folks say things like, generics and name brands are the same, or there's no difference. So allow me to don my autistic writer's hat and say that's incorrect, and it comes from an imprecise use of language. Similar and same are not the same thing. To be similar, it needs to have qualities that are mostly like the original. To be the same, the qualities of the thing need to be identical. The average person does not care about minor details like that, but in medicine and law, they are extremely important because they interpret the words literally. That's where sayings like letter of the law come from. Now, I spent years writing articles and blog posts for attorneys and doctors, and two things I learned are that lawyers are often unfairly villainized, and two, the improper use of words can cause serious issues because other professionals will interpret words literally. Generics are not the same as name brand medication. They are similar in that difference matters. The key difference is in the inactive ingredients, which are the other materials in the medication that aren't providing the direct therapeutic benefit. People can be allergic to or have adverse reactions to inactive ingredients. Well, why does that matter? Let's say you make the choice to start on a name brand med that's covered by your insurance. You lose your insurance, so your doctor's just swapping you to the generic version. You may start that generic version and it's causing other issues for you. It may be that you're allergic to some of those inactive ingredients in the generic, or it's just not functioning correctly for some reason. Now, one of the reasons that generic drugs are cheaper is they don't need to go through the same level of clinical trials and testing as the name brand. So sometimes issues can slip between the cracks. One example of that was an issue with generic Wellbutrin, where a whole lot of people were having a real hard time with it because it wasn't evaluated properly. That happened in like the mid-2000s-ish. What they did was they extrapolated the data from the 150 milligram dose and applied it to the 300 milligram dose instead of doing the correct evaluations. And it caused serious problems for a lot of people. Now, I remember when this was going on because online communities were flooded with complaints about how people were having an absolutely awful time with it. And that aside, in support groups, I've regularly seen people dismiss the concerns of those who've had to swap from a name brand to a generic and were having a bad reaction. They're told it's the same, it's all in your head. No, it may not be. It may be that some different inactive ingredient is causing an issue. They are not identical, so they are not the same. They're similar. 5. The question of what medication works for you means virtually nothing. I know that it's a scary prospect to be looking at starting a medication. A lot of people turn to the internet or ask other people what medications work for them. What they're doing is trying to make an educated decision about what medication they're going to take and what the potential side effects are. The problem is that information doesn't mean anything for you. Now, I specifically stopped talking about what medications I take after someone commented that maybe if they work for me, then it might work for them too. I mean, maybe. Or maybe it can have awful side effects that you can't deal with and you can't take it. You won't know until you take it. We're looking for control and to try to make an informed decision, but the reality is that you can't. Your doctor is the person who's most likely to be able to do that for you. They may ask your opinion if you've done any research, and that's because a lot of places use what's called a patient-led care model. Patient-led care is meant to make you feel more control over your treatment, and that you'll be more likely to stick with the treatment if you have a say in it. However, I didn't go to school for 8 years with continued education, with continued industry and news updates about treatments, and with the internship hours of my doctor. I don't believe it's possible for me to make a fully informed and educated decision about that for myself without their input. So if you don't know where to start, ask your doctor. That's what they're for. And additionally, this is a little side tip. If you ever have specific questions about your meds or drug interactions, try reaching out to your pharmacist. That's their specialization, and they're usually way easier to get a hold of than your doctor. 6. Always be skeptical of opinions and advice about psych meds from people who aren't your doctor. You can never be certain of the full truth. The person giving your opinion or advice may not even fully understand their whole truth. So let's say you know your friend was on a med for a while and you ask them what their experience was on it. They say, "Oh, I had a terrible time on it. It made me feel more unstable. Don't take that." What do you do with that information? Do you take it at face value because they're your friend and you trust them? After all, they don't want to harm you, right? Right. They're just trying to be a good friend. But here's the problem. You don't know what you don't know. What do you mean by terrible time exactly? How did it make you more unstable? Were you taking it as directed, or were you missing doses all the time? Were you abusing any substances while taking it that may have affected how it was working? Are you correctly diagnosed? Do you have any other health problems, physical or mental, which could have affected how it functioned? Were you taking any other meds that could have affected how it functioned? Were you eating grapefruit or drinking green tea? A lot of people know that grapefruit can mess with medication. It's far less known that green tea can affect how a variety of psych medications work too. For example, green tea will remove lithium from your blood. You may medicate to accommodate for that, but then if you stop drinking green tea, it can spike your lithium levels. So on and on and on the question should go. And if you're on the receiving end of that kind of question, you should be extremely careful of how you answer it. The answer I've adopted most often is, it really doesn't matter how it affected me because I'm not you. The only way you could truly know is by taking it and finding out. Now, there's only one piece of advice I ever give related to taking psych medication, and that is, if you're going to take psych meds, take it as directed. If you're having a hard time, you need to talk to your doctor to see if you need an adjustment or a different med. Another phrase that I found myself repeating over and over again is, have you told your doctor what you just told me? No? Then you need to. If you have fears, concerns, or you're not sure about something, ask questions. Ask questions until you understand the answer. Any good mental health professional is going to be willing to take the time to explain it to you if you ask. The ones that won't explain are one of my red flags. I respect the fact that they did the work to be where they're at, but at the same time, people make mistakes. And if a mistake gets made, I'm the one that has to live with the consequences. If you can't explain it to me so I understand it, or say that you don't know, then I can't trust you. I advise others to adopt a similar approach. And despite the tone of a lot of this post and what you'll find throughout my work, I'm not pro big pharma or mental health industry. The system sucks. It's broken. Too many people fall between the cracks or get overlooked. There's never enough resources because we as a society don't protect or provide for our most vulnerable people like we should. So in my eyes, it's the least worst option out of all bad choices. I know that medical trauma exists. I know that some professionals are garbage people and totally unprofessional. I know that a lot of these people are overworked and underpaid, which reduces their ability to provide meaningful care. I know how deathly afraid of losing your freedom and going inpatient can be. I know that being on psych medications is not fun. I've been on like a dozen myself. But, at least for me, it's the least worst option out of all bad choices to truly exert the most control I can have over my mental illness. 7. A gene test might get you better results with medication faster. This is not an endorsement, and I have no affiliation with this company. I have also not personally used their services. However, the company GeneSight offers a genetic test that can help your doctor better understand what psych medications might be most useful or harmful to you. I've known several people who've gotten this test done and credit it to dialing in their medication more efficiently. According to their website, at the time of this recording, 98% of their patients pay less than $330 or may be covered by your insurance plan. Or if you don't have insurance, they apparently offer some funding options if you can't afford to drop a few $100 on the test. Medication roulette sucks, and any way that we can find to take steps to make it more efficient is a good call. It can take years to find the right combination of meds as you go on and off of them. They can work for a while and stop working. They may never start working. You may spend 4 months stepping up a med to a therapeutic level where it's supposed to help you, and then it just doesn't. You may be able to avoid that nonsense or streamline the process more. Now again, I can't vouch for it from personal experience, but I've heard it discussed often enough that I feel it's at least worth mentioning for you to research and consider for yourself. 8. Just because you found the right meds doesn't mean they'll last forever. A common mistake I've seen my peers make is assuming that because they found the right medication that works for them now, that they no longer have to worry about the disorder. That's not true. Things change. Your body and brain chemistry changes as you get older. Other health issues can complicate things. You may still experience more stress or extreme circumstances that can push your mental illness past the effectiveness of the medication. They call those breakthrough symptoms or a breakthrough cycle, as in it broke through the effectiveness of the meds. You can be stable on medication for a long time, decades even. However, sooner or later, things are going to change in some way, and it may not be for the better. You may not need as much active monitoring when you're medicated as when you're not, but you still shouldn't push it out of your mind completely. It's worthwhile to consider how your symptoms, mental and emotional state have been at least once a week when you're stable. That way, if things start acting up, you can hopefully catch it early before it becomes a much bigger problem. It takes all of a minute and can save you so much heartache if you catch it early and need a med adjustment. Even if you're taking meds and you start experiencing symptoms, it's not necessarily anything you did wrong. Needing to get medication tweaked and adjusted throughout the course of treatment is totally normal. You should expect it because it will happen sooner or later. Nothing stays the same. To be clear, that does not mean you're doomed to backslide into whatever abyss you managed to claw your way out of. Instead, it's to be aware. If you notice you're experiencing symptoms, or one of your loved ones points out that you've been acting oddly, don't write it off and ignore it by saying, "I'm fine, I take my meds." You may be at the start of not being fine. The earlier you identify and address it, the better chance you have of not backsliding significantly. 9. The point of medication is to improve your quality of mind and life. It is mind-boggling to me how many times I've seen people who don't think about the impact of their medication. So I would just like to remind you that the point of taking the medication is to help you feel better. If it's not helping to make you feel better or making you feel worse, then it's something you need to talk to your doctor about. It may be time for a med adjustment. Just because you take the medication religiously doesn't mean it's doing anything for you. I recall a conversation I once had with a woman who had been on an antidepressant for over a year and was complaining that it didn't work. After some additional probing questions, she eventually revealed that she had never stepped up from the introductory dose of the medication. She wasted a year of her life taking too low of a dose because she never connected that, hey, this medication is supposed to help me feel better. It's supposed to improve the quality of my mind, which should allow me to improve the quality of my life. And I use that language specifically because it's not always perfect, but it's far from the only example I could cite either. It's something I've heard from my fellow mentally ill people all the time, just all the time. In a perfect world, you'd get on the right meds at the right dose and be able to function like anyone else. However, that's not how it is for some people. For some people, taking the meds reigns in the extremes, but it doesn't make them perfectly stable. It just makes things more manageable. Sometimes it's the best you can hope for. If it's manageable with minimal side effects, that may be preferable to perfectly controlled with a severe side effect. It just depends. It's something you need to discuss with your prescribing doctor in depth once you start reaching that point. 10. Talk to your doctor if the quality of your mind is getting worse. To reiterate, the point of taking the medication is to improve your quality of mind so you can be healthier and improve the quality of your life. As you start taking medication, you should regularly take stock of the environment of your brain. Mood tracking journals or apps are a great tool for this. Nowadays, I tend to check in with myself about once a week unless I notice some of my symptoms acting up. My thought process goes like this. I think, how am I doing? Am I having any different thoughts or feelings than yesterday, or a week ago, or a month ago, or 3 months ago? Now, I think in that longer time frame because the point of maintenance medication is to improve the quality of your mind over the long term. Now, am I doing better or worse than when I started this medication? What exactly is better or worse about what I'm experiencing so I can clearly communicate that to my doctor? Now, if you find yourself at a position where you're taking the medication and you feel more volatile, moody, angry, or emotional, then it may just not be a good fit for you. Bring it up to your doctor because you may need a different approach. Now, I'll say this again because I really want you to hold on to this. The point of taking the medication is to improve the quality of your mind and life. If it's not doing that, then you need to advocate for yourself to your doctor for a different solution. 11. Be wary of the decision to go off of medication while you're doing well. I have never understood why people do this or don't seem to view it as the major potential life-changing decision that it is. If you're taking maintenance medication to keep everything under control and smooth, why would you choose to stop taking it or want to come off of it if you're doing well? Now, I get that there's sometimes it's a struggle. There have been plenty of days where I stood in front of the mirror with a handful of medication and thought, fuck these meds. I don't want to take this shit. I was angry and resentful of it for a long time. Then I'd be angry and stew about it for a while and then take them anyways. For a long time, I hated knowing that my ability to be well and stable was reliant on medication. But I hated the effects of my uncontrolled bipolar disorder even more, so I always took it. Now, I know a lot of people fear the long-term side effects of taking psych meds, but I know that I'm not going to have a long-term if I don't keep my brain under control. And that's the reality a lot of us wrestle with accepting. I've seen a number of people who have found success on meds, are balanced and stable, but then want to see how well they do off the meds. I understand the desire to not be on them, but that's not some light decision to be made. You're essentially taking the guardrails off of unwellness. And if 90% of people are going to cycle again sooner or later, that's a pretty high probability for bad times in the future. Just because you're doing well doesn't mean that you no longer have bipolar disorder. You still do, and you'll feel it when you hit a trigger that's strong enough to swing you unwell. Then you get to go through the whole medication process again of weaning up to the appropriate therapeutic dose, which will take weeks, if not months. And guess what? The medication may not even work the same the second time around. As I pointed out previously, things can change in your body and brain chemistry. You may go back onto that medication and it just doesn't work the same way or work at all. That happened to the author David Foster Wallace. He quit his primary medication for his severe depression to try other options, but other meds and electroconvulsive therapy didn't work. Then, when he tried to go back onto the original medication, it didn't work either. And he would end up completing suicide about a year later. It's one thing if you're having a bad time on a med and it's bringing down your quality of mind or life. But if you're doing well while you're on it, quitting your meds is not a light or flippant decision to make. It can have severe, lasting consequences. 12. Psych medication may only be one step in the process of recovery. Now, I want to share an interesting personal anecdote. I was undiagnosed for 15 years, from the time I was about 13-ish to about 29. I can't remember exactly when I started bipolar cycling, but I know it was around 13 or 14 years old. I spent probably 80% of the time I was undiagnosed mildly to suicidally depressed. There's so many habits, perceptions, and choices I made through the stained perception of my depression. I was hopeless for so long that I didn't see much of a point in doing anything. By the time I was 29, I was looking around at my life and thinking, I never expected to live this long. What the hell do I do now? Now, I needed talk therapy to help examine my habits and beliefs, to discard those stained by the bipolar depression and my anger. My counselor at the time used the analogy of the brain like a musical instrument. I'd been playing the instrument out of tune for 15 years. The anger, depression, and hopelessness was normal to me because that's what I was experiencing most often. I needed to retune my brain so that my thoughts would align better with a healthy mental state, healthy perceptions, and a healthy way of conducting my life. Now, this is also why some people who start an antidepressant attempt suicide. The chemical problems may get fixed, but the unhealthy thought patterns haven't been addressed. So then they have the energy and motivation to go out and act on their self-destructive thoughts that they wouldn't have if they were just depressed. People like that typically need medication and therapy, not one or the other. If you've been living with mental illness for a long time and you're undiagnosed, I highly suggest going to talk therapy while you start and take your medication. That way you can start evaluating the different ways that you think and the ways that you look at the world and make sure that they're correct and not fueling your own depression or misery further. Now, in communities and amongst my peers, you regularly hear things like, well, medication isn't going to fix me. No, it's not. And if you've been mentally unwell for a long time, you may need therapy to unmake unhealthy habits and patterns of thought to replace them with healthier ones. Being depressed, I was always of the opinion of how much the world sucked, people sucked, everything sucks because look at this fucking dumpster fire. Hell, look at it now. There's so much hopelessness in that bleak mental space, and it made me a pessimist. Now, I'm more of an optimist, but even that word comes loaded with its own nuance and stigma, because people assume that to be optimistic, you need to be blind to suffering. I'm not blind to suffering. I've lived it. I've seen it. I'm watching it unfold right now. I seek it out and witness it at times to help strengthen and grow my empathy. But I'm optimistic because I also believe that there are solutions to most problems. I may not know the solution myself, but there's a whole lot of other people in the world that probably do. The system can be better. Society can be better. We can all be better. It's just hard to do, particularly if your perception's still filtered through previous experiences and unwellness and trauma. If you've been mentally unwell for a long time or have long-term trauma, you will likely find some benefit in going to talk therapy to examine your perceptions, beliefs, and actions to see if they need to be worked on so old patterns don't make your present and future harder. I also highly recommend mental health journaling to sort out your thoughts and feelings, if it's safe to do so. If you're around people that won't respect your privacy, that may not be a good choice because they'll just read your work and use it as a weapon against you. If you're in that kind of situation, you might borrow a tip from computer programmers and employ the rubber duck method. That is, they explain the problem they're trying to fix to a rubber duck or other inanimate object, as though you are trying to help the object understand what's going wrong. By doing that, it forces you to slow down, articulate your thoughts, identify the problem, and help you process what you're thinking about. And that works with emotions and perceptions too. In fact, that's what a lot of people are doing in talk therapy. And I think that's where I'll end this episode. Now, as I sign off, I would like to reiterate, I am not a mental health professional, just a mental patient with a microphone. I've included quite a few links in the show notes for sources to back up factual claims. Still, the best way to make decisions for your care and treatment is with the help of certified, licensed mental health professionals. Thank you for spending your time with me. Hit subscribe on your way out and share this with someone you think it might help. If you want a transcript, I have them posted on my free Substack in an article format. Be well.